Welcome to the Ask a Therapist podcast, where we talk with medical experts about mental health and some of the stigma surrounding it. I'm one of your hosts, Sean Jackson. Today we have Dr. Brian Steele, a psychiatrist, consultant, and telepsychiatrist. Thanks for joining us today, Dr. Steele. Let's jump right into it. We know that mental health is a serious topic, and I want to dive a little more into a conversation around men's mental health specifically. In your experience, are men likely to have mental health struggles in life?
Men are likely to have mental health struggles. They are less likely to seek help, though, than women. So women are twice as likely to seek help in mental health than men. But men certainly have mental health struggles, as characterized by the fact that men are 4 times as likely to commit suicide. So mental health is a very big problem for men, particularly substance use. Men are less likely to seek help for things like depression and anxiety, but they struggle with those things. They often present with different symptoms, and it can be a little bit more difficult to recognize in men.
I could totally see that. I myself struggled for a long time with mental health and didn't speak up. For everyone listening, what are some of the symptoms that men might show that may signify that they're experiencing some sort of mental health struggle?
So some people use the term that women act in and men act out. And so what they mean by that is that men will demonstrate signs of irritability and aggression. Sometimes they'll engage in impulsive behavior. They'll drink alcohol. And men still have some of the same kind of classic symptoms that we think of too. So a depressed mood, things that you see in both men and women is difficulty sleeping. So we call them neurovegetative symptoms, where somebody is having trouble sleeping and their appetite is off, and they kind of feel fatigued or aren't having the same energy that they're used to having.
So when someone's experiencing symptoms like this, especially men, why is it so important that they seek mental health treatment?
Well, there are a lot of reasons that it's important to seek mental health treatment for men. One main reason is it impacts all of the health of your body. So your brain is the most important organ in your body, and it controls the health of a lot of your body. By that, I mean people who struggle with mental health problems are more likely to not get treatment for other medical conditions, such as heart disease, problems with their lungs. And on top of that, people who are doing well from a mental health standpoint, when they struggle with those other illnesses, such as cardiovascular disease, people with mental health problems tend to have worse outcomes. They don't do as well. They have more complications, and they end up needing more intense treatment for their medical problems. They're often less compliant with treatment for their medical problems. And so we know that when we address men's mental health issues as well as women, that they do better with their medical problems and their whole body does better. It's also important because other people are watching, right? The people that you care about are watching how you handle your mental health. So if you engage in things like going to therapy, exercising regularly, avoiding alcohol, your kids and your family see that. And behavior modeling, them seeing how you behave, is a key factor of how they will behave. Behavior modeling sets up how most people tend to interact. It's one of those things we talk about with your parents that's ingrained at an early age. When you see your parents engage in certain activities and parent a certain way, you're likely, unless you take significant steps to change that, to do some of the same things. And so picking a lifestyle that is healthy and engaged toward improving your brain health, aka mental health, is an important aspect of your health and your family's health.
I really like that concept of behavior modeling. But I do want to take a step back for just a second. You mentioned earlier that men deal with substance use more than women during a mental health crisis. Can you talk a little more about this?
Men are much more likely to deal with substance use disorders, about twice as likely. And last year we had more people have an overdose than any other year. Fentanyl and the opioid crisis has become a huge problem, and men are much more likely to overdose. And so it's very important that men seek treatment for substance use disorders. Men are more likely to have problems with alcohol, and thus it's a very big issue.
I feel like all men want to be the best possible role models, fathers, friends, husbands, and obviously mental health plays a huge role in this. What can we do to have a positive mental health outlook?
Yeah, so mental health in general is about taking care of your brain. So it's more than just seeking treatment when things are going wrong. It's about having an entire lifestyle that's geared toward improving the health of your brain. And many of those things are some of the same things that we would do to protect the rest of our health. So we would, exercise regularly, avoid alcohol, engage in things that improve the way we think about things. In mental health, we call it cognitive behavioral therapy. So we engage in processes that are deliberate to change our thoughts in order to improve our mood. And meditation, things like those things can reduce your stress levels, and stress levels feed back to the rest of your body. So your brain interprets stress in a chemical fashion. It produces cortisol, and part of the reason we make cortisol is a stress hormone, and part of the reason that we make cortisol is that our brain perceives that we're stressed. And so when our brain perceives we're stressed, it makes a chemical called corticotropin releasing hormone. It makes a thing that causes that cortisol to get released. And so your brain actually triggers how your body responds to stress. And so if your body is stressed, your brain makes hormones that cause your entire body to get stressed, your heart to undergo stress, your lungs to undergo stress. And so changing those lifestyle points, the exercise, the meditation, avoiding alcohol, and other substances that could affect your brain is a key part of having good brain health and good mental health.
So would you say therapy is helpful for men to seek out?
Therapy is very useful for men and for everyone. So it's interesting that we don't, psychiatrists sometimes say we should put CBT in the water. So cognitive behavioral therapy is the process by which it's coping skills. So we learn to change our thoughts in a way that is more healthy for the purpose of improving our mood, decreasing our stress. So an example of that would be if someone has the thought, I'm the worst father. I am horrible at being a father. Well, you're not the worst father in the world. That's not a correct thought. You may not be the best father in the world, but you're doing the best you can is an alternative thought. So you have the people come up with alternative thoughts. And so it's supposed to be a rational, balanced thought. And that practice of coming up with balanced thoughts in our brain is important for reducing stress and causing us to have a more realistic outlook on life in general.
How can perfecting that skill set and prioritizing a healthy outlook on life help men become an excellent role model for not just their families, but also those around them?
So engaging in good brain practices, healthy brain practices, is important for your lifestyle and your family. So the best thing that you can do to help your family improve is actually work on yourself. Because when you do those things, when you exercise regularly, avoid substances that are harmful for your brain, such as alcohol, go to therapy and use those skills, your family members will see that. And they will then model that behavior. You can also take a very active role. You could enroll your kids to see a therapist. You could talk about meditation cards. In our family, we do meditation cards, and we have one of our kids seeing a therapist because it's an important practice for your family to have someone that they can talk to and feel comfortable talking to, and importantly, develop those thought patterns that are good coping skills for life. And so part of working on your mental health is recognizing at some point I may deal with a significantly larger stressor than I am dealing with right now. And so it's important that I work on my mental health so that when that big stressor hits, I can be the calm in the storm. I can be as the version of me that I'm interested in being and cope with that stressor appropriately. So mental health is not just about seeking treatment when things aren't going well. It's also about prioritizing your brain in order to have a good outcome. We all work on hopefully our cardiovascular health, and we exercise, and we talk about that as a society, that's an important thing to exercise. And similarly, our brain could be thought of as that. We need to engage in exercises that our brain needs, such as therapy-based exercises and meditation and physical exercise and avoiding bad substances.
All of that makes total sense. I've even seen myself how just getting in one gym session, whenever I'm just kind of stuck in that mental rut, can make all the difference in the world. I do want to dig a little bit deeper though. Many men grow up thinking that you just push all your feelings down, you don't tell anyone, and somehow if you have feelings, have emotions, that you're going to be regarded as weak. What are your thoughts on that?
Particularly in men, there is this unfortunate stereotype that having problems with mental health means that you are less of a person, or that you're weak, or something's missing, or something's wrong. We all have brains, and those brains are very complicated organs. And just like your liver, they deal with dysfunction and need help, and sometimes need medication and other levels of treatment. And unfortunately, that stigma has led men not to seek help and seek treatment. But from an engineering standpoint, so men trying to get stronger, build a stronger building, so to speak. So the brain is a critical piece of that building. And making it stronger is a critical part to securing the building.
Thank you so much, Dr. Still, for joining us. And thank you to the listeners for tuning in today. This has been Ask a Therapist, a Blue Cross Blue Shield of South Carolina podcast where we dive into mental health topics. Be sure to check out other episodes of Ask a Therapist for more mental health advice, and we look forward to seeing you on the next one.